hope you had a wonderful Memorial Day weekend. I'd like to welcome you to today's webinar. This webinar topic is Parties, Playdates, and Babysitters. Oh my! I'm Linda Mitchell, and I'm president and founder of Kids with Food Allergies Foundation, and I have the privilege of being your moderator again today. Today our presenters will be answering your questions that you sent in on navigating these caregiver situations that so many of us become nervous about, including myself. This will be a very interesting and lively session, so I'm glad you joined us. We have two wonderful speakers today, Dr. Michael Pistiner and Dr. Sarah Boudreau-Romano. Dr. Mike is a passionate patient educator, an accomplished pediatric allergist, and a dad to a son with a food allergy. He's also chair of KFA's medical advisory team, where he does an amazing job. I also want to welcome Dr. Sarah Boudreau-Romano, a pediatric allergist and mom of children with food allergies. Many of you know Dr. Boudreau-Romano from her writings on her blog, theallergistmom.com. I want to give a special thanks to our speakers today. The speakers for all of our webinars are doing so as volunteers without compensation. I'm very grateful for both of our speakers to donate their time to be here with us today. Before we get started, I need to run through a few important housekeeping details about this webinar, and during this time, we have 3 quick polls that you can take. First of all, today's webinar is made possible through an unrestricted education grant from Mylan Specialty. We rely on donors and corporate partners like Mylan Specialty for the financial support that enables us to develop educational programs for families. Next, please remember that this webinar is of general nature only and is not medical advice. While Dr. Mike and Dr. Sarah are doctors, they are not your doctor. You should consult your own physician or healthcare provider for any medical advice you seek with regard to food allergies and other medical conditions. And please know that we are not trying to imply that any food ingredient products, medications, treatments, etc. that we may mention today are safe for you or for your family. You need to consult with your own physician, and with regard to foods, of course, always check labels to make sure they're safe for you, your child. Today's webinar is being recorded. You will receive a follow-up email from us in a day or two with information about how to access the archived version of this webinar. And since we have a large audience here again today, we have everyone on listen-only mode, but you will see a chat box and questions, and you can type in questions, and we will be able to answer some of those for you today. As a reminder, we will not be able to answer each and every question that has been submitted and will be submitted. It's hard to choose which ones to answer, so we focus on ones that pertain to today's webinar topic, and 2, those that will be of interest to the large majority of our audience as best we can predict. Our presenters will be starting with a run-through of some basics about what you need to do to prepare your child to go to a party, play date, or to use a babysitter. Then we will have discussion of topics based on questions submitted by parents. Towards the end of today's webinar, we will stop to give away 1 copy of Dr. Mike's children's book, Everyday Cool with Food Allergies, and 2 KFA beach towels, just in time for summer. The recipients of these gifts will be picked randomly from those still in attendance later in the webinar. When we end the webinar, you will see a survey, and we'd like for you to share your impressions with us, as we will take your feedback very seriously to improve the future direction of our webinar series. So before I go ahead and introduce our speakers, this is a special week since last week we had we started our response to the Oklahoma tornado relief for families with food allergies. There is a great need for allergy-friendly food, food banks and other disaster relief agencies. They don't understand food allergies like we understand food allergies, and so we've made some contact with a food bank in Oklahoma City, as well as a church in Oklahoma. Well, through a local food allergy support group, a church has agreed to accept food donations. So if you are interested in finding out how you can help, either by sending allergy-friendly food or by sending monetary donations that can be used towards purchase of foods for these families who need special diets, I encourage you to go to our blog that's on our website, and Melanie Carver just put up the link if you want to click on that at any time later to check it out. And we appreciate your support. I know the families who need these supplies are really appreciative of the efforts that you're making to help them. So what I'd like to do now is to introduce our speakers, Dr. Michael Pistiner and Dr. Sarah Boudreau-Romano. Michael Pistiner, MD, MMSC, is a pediatric allergist and medical director of shared medical appointments for Harvard Vanguard Medical Associates, as well as instructor of pediatrics at Boston Children's Hospital. He is the father of a child with food allergies and serves as a voluntary consultant for the Massachusetts Department of Health School Health Services. He is a fellow in the American Academy of Pediatrics, where he's a member of the School Council on School Health and the section on allergy and immunology. And he's also a member of the American Academy of Allergy, Asthma, and Immunology, where he is a member of the Adverse Reactions to Food Committee. He is chair of Kids with Food Allergies Foundation's Medical Advisory Team, and he serves on the board of directors for the Asthma and Allergy Foundation of America New England chapter. He's also a member of the National Food Allergy Management and Education Advisory Board, FAME, and is the author of Everyday Cool with Food Allergies, a children's book, and co-creator of allergyhome.org, a website that provides free modules designed to increase food allergy awareness in the community. Dr. Sarah Boudreau-Romano is a board-certified pediatrician who completed her training in allergy and immunology at the now Lurie Children's Hospital and Northwestern Memorial Hospital in Chicago. She is the mother of 4 children, 3 with a history of food-induced anaphylaxis and 2 with a history of food protein-induced enterocolitis syndrome, or FPIES. She is a fellow of the American Academy of Pediatrics and a member of the American Academy of Allergy, Asthma, and Immunology and the Illinois Society of Allergy, Asthma, Allergy, and Immunology. She currently is serving on the advisory board for the Food Allergy Initiative in Chicago. Sarah began the blog The Allergist Mom last year in the hopes of connecting with and supporting many families learning to live well with food allergies. So what I'd like to do now is to welcome Dr. Mike and Dr. Sarah for joining us today, and I will hand over the virtual microphone to both of them so they can go over the polls that you've submitted so far. So Dr. Sarah, would you like to start going over the polls?
Sure. So first of all, hello everyone. Thank you, you guys, for letting me be here today. So the first poll we asked was, what is the age of the child with food allergies you care for? And it looks like the majority of us who are on the webinar today have children who are toddler age, 1 to 3, and then young child, 4 to 6-year-olds, about 37%, middle-aged children, 7 to 12 is 16%, and then a smaller group of us have infants or teenage or young adult children. Our second poll was, how long have you been managing children's food allergies? Looks like the majority of us, about half, a little more than half, have been dealing with food allergies for more than 3 years, 3 or more years. A quarter of the people today have been dealing with food allergies for 1 to 2 years, 20% about 3 to 12 months, and there are a couple of people who are just beginning this process and have been managing their child's allergies for less than 3 months. The last question, I believe there were 3 questions. How confident are you about managing your food allergies? And I think this is where we all sort of end up, you know, at different times during our day, is somewhat confident, which is about 66%. 30% of people feel very confident, and we have 5% of people who do not feel very confident, and we hope to be able to get everyone shifted a little toward more confident at the end of today's webinar.
Everybody hear me?
Yes.
All right, well, I made it. So thanks. Our topic today, just like any of the other topics we've been talking about, we always are going to need to start with the basics, which is practical food allergy management. And wherever our children are with food allergies, prevention and emergency preparedness need to be implemented at all times and in all circumstances. To prevent, we avoid, we communicate, and we teach. Act to prevent. To be prepared, we need to be ready to react, to recognize anaphylaxis, administer epinephrine, activate emergency response, call 911, and have an ambulance take the child to the emergency department where they could be observed. Now, this is the case if our children are at a restaurant or at our home or at school or in the care of someone else or others, for example, a babysitter, a party or play date, and that's kind of where we are today. And so we'll be getting into some of the details about how you take these basic prevention and preparedness strategies and apply them to these circumstances and keep our kids safe while at the same time they're being kids. Now, a couple key things, like I just mentioned, as far as preparedness and prevention, a couple key things are going to help us in this needed management. One of them, this is showing one parent teaching another parent using a food allergy action plan, a food allergy emergency care plan. This is going to be something that's really going to be an important thing to pass along to anyone who is potentially responsible for our children who have a food allergy. This is something that people don't always do, and I think that it really can be a very helpful tool because it really clearly lays out for someone in an almost recipe-like way what to do in the case of an allergic reaction. And us as parents, we've gotten used to it. It's hopefully cold to us, just easy to do, but it may be a little more challenging to the person less experienced. And now what we have up here on the screen is an example, or this is an excerpt of the caregiver babysitter tips. And what that is something that that we created to try to help passing off the responsibility of our children to others, like a babysitter, a relative, a drop-off party, or a drop-off play date, to remind people, to remind us of what we should be teaching the people responsible for our children. Some of the prevention strategies, like label reading, about knowing about possible sources of cross-contact, especially in the case of someone who's responsible for preparing food. And then also, it also outlines, I think that the next slide actually shows the different sections that outline some of the specific tips. But not only going through prevention and preparedness, or prevention strategies, but also preparedness strategies, and along with knowing some of these, having that emergency care plan that we showed earlier. And then one thing that this does also is stresses the importance of communication, that there's some information that we may not always think about while we're caring for our own children that other people are going to need to know. Like now in the day of cell phones, knowing where you are is really important. So if there's a babysitter and there were an emergency, calling 911 and being able to tell them where they are, especially if they call from their own cell phone, is going to be really important. Knowing some of the specifics of our children beyond just what they're allergic to, but also their weight, also potential drug allergies, and other contact information is really important. So this food allergy babysitter form and drop-off guide is pretty helpful for that. And I'll let Melanie go through these to our first topic. And so now we'll get into the fun and the nitty-gritty. But for our structure will be, we'll start talking about babysitters and answer some of your questions, and then answer some questions live. And then we'll get into talking about play dates, and then getting to talk about parties. Now, we're starting from the situations where we as parents have more control. We can choose who is going to be caring for our children. We can choose the babysitter. We could choose the relative. We also could choose the venue, the place where we're doing it. Then with play dates, we have a little bit less choice, and with parties, even less. And so with that, let's get started. So Sarah, I'll pass this one to you.
All right. So the first question we have is, my husband and I have a hard time trusting others to deal with an emergency. At what point did you finally go out for a date night and leave your child with a babysitter? So, I can definitely speak to that, and I remember, and I still have this sort of anxiety when I leave my kids with anyone else. But we did have 3 kids in 13 months, so not only did I have a hard time trusting people, I also had a hard time finding people who would be willing to take care of all the kids, and on top of the fact that they, had the food allergy complications. So I would say that how we started, and I feel like this felt like a really good place for my husband and I, is we started having babysitters at the very beginning when the kids were young, almost always either after they went to sleep or after they had already eaten dinner. And that was sort of a way that we eased ourselves into it, where food was not involved. We would have the babysitter come to our house, mostly family members. We've just now had a couple of babysitters who are not part of the family. But definitely starting off, having someone that you know very well or have known for a long time or feel got a good reference that can be educated and is willing to learn and excited about your children and cares about your children. But I feel like the best way for us was starting off where the babysitting event for our date night was was a time at which there was not eating. So that's how we started off, and we always stayed relatively close. Obviously always educated whoever was with the children, even if they were sleeping or even if they had already eaten, just in case there was an emergency. And, I love Dr. Mike and KFA's babysitting sheets because they really help you educate somebody. And I think that education and taking that extra time, like having the babysitter come a half hour before you leave to really educate them and get them to feel comfortable is the only way that you're going to feel comfortable. Because why have a date night if you're totally stressed? And so I think that that's the most important thing, is figuring out how you can have a date night that's actually enjoyable, and what steps you need to take to actually have that date night be worth it for you.
Totally agreed. And I think that easing into it is key. And then also that pre-planning. That first time that you're going to train that babysitter or relative, you're never going to have that first time again. There's going to be a second time and a third time and a fourth time. And so putting aside the appropriate time to actually be able to address to this really important issue is going to be key. They're going to be worried about what time do I feed the children, where is this, where's the remote control, what time is bedtime, which chapter do I get to? Oh, by the way, this is how you give an auto-injector, and this is how you read a label, and please don't kill my child. That's a whole lot at once. And so taking time specifically dedicated to this is how you take care of my child's food allergy. And by the way, we can talk about this other stuff at the time when we're leaving.
Definitely. I mean, I don't say it jokingly, but whenever I have babysitters, I always say, like, this is the most important thing I'm going to tell you today. If the kids go to bed late, or if, homework doesn't get finished, or something else happens, as long as they're safe and you know how to use this, injectable epinephrine, then it's going to be a good night for us. And so it really does change your perspective on what's important for the evening. And if something's very important, I often just write it out so that the bedtime and where the remote is and everything is sort of extra, and that can be, looked at on a little list that I make, but that the focus is really about the food safety, and going through how to use the epinephrine. And I did notice on one of the questions, I don't know if this is one that's on the board or not, but definitely going through the injectable epinephrine training with a trainer is just so important. Because you can hand them that and you can, say the directions are on the side, but there's nothing like actually using the trainer to feel confident, and then putting that medicine along with the emergency action plans in a very visible, easy to access spot, so that once you've gone over that action plan, they can go right back to that plan, and it'll trigger them to remember what you talked about. So you always want to give them that plan so that they have a place to go to. Dr. Mike, I'm sure you remember, in your medical training, even in the ER, like, everything has a flow sheet, a flow chart of how you manage emergencies. And it's not just, babysitters that need to use them. parents need to use them, physicians need to use them. They're a really good way to be able to manage an emergency as calmly as you can by going through a checklist of symptoms and then saying, now I realize I need to use the medicine. It really helps keep everybody very rational as you can be in the time of an emergency by having a written out plan that is you've already talked through and that's sitting on a counter for them if they need it.
Absolutely, and then going through it, especially at that first time, that first training will be really important. And then what we're talking about now in relation to babysitters and potential relatives who are watching, this is going to be something that we're going to need to implement at the drop-off parties and the drop-off playdates as well. So everything we're talking about right now really applies to the rest of today's webinar.
Right, so it looks like the next question is, how do you get family members and babysitters to understand the seriousness of food allergies? My in-laws think I'm overprotective and overreacting. I mean, this is a very tough question, and I think that it's something that we all struggle with. And I guess that my big feeling is that you need to find someone who really understands it and they don't think you're being overprotective to babysit. And I don't know what your take on it is, Dr. Mike, but if I felt like someone wasn't taking it seriously, even if they were a family member, you may find someone else, another babysitter that is familiar with food allergies who may be a better option to babysit. And if you don't have any other options, then you really need to sit down with this family member and really educate them. Have them go through your allergy home websites, have them read through the Allergist Mom blog, get it from a different perspective. But you need to leave your children with someone who understands the seriousness of it.
Absolutely, and I think that feeling confident in yourself is going to be really important here. Being confident that you are being reasonable, rational, and educating in an appropriate fashion. And if that person can't open their eyes and be aware of the seriousness of what you guys are talking about and doing, then you're going to it's going to be safest to find someone else. And there doesn't necessarily need to be hard feelings. Some people just are not going to be able to move themselves and meet us halfway and open their eyes to this situation. And if those are the people who you're attempting to reach out to care for your child, then saying no thank you and finding someone else who is willing to be educated is going to be in everybody's best interest.
Yeah, definitely. I mean, there are even some of my own family members who I wouldn't sign them up for babysitting my children.
Yeah, and I would actually, and that's really challenging, and luckily that's somewhat rare. But where we're going to see it even more, and we might as well hit upon it here, is going to be the potential drop-off party and the potential drop-off playdate, where now all of a sudden we have a classroom full of 22 kids. Of those 22 families, we are going to come up against people who aren't really going to take us seriously, and it's going to be really important to be able to assess that, to be able to know who is not willing to be educated, and then just figure out a way around it.
Right. Should we move on to the next question?
Let's do it.
Okay. So this question is, should only food that I prepare or label be served while I am away? Or should I teach family members and caregivers how to read labels every time and prepare foods for my child? So this question has a lot of different ways you can approach it. I mean, I think that if you have somebody who is a nanny, you're obviously going to have to teach those people how to cook food. Because eventually you trying to make breakfast, lunch, and dinner the night before you go to work and have the babysitter feed those foods to the kids may eventually get pretty tiresome and difficult to accomplish. So I think if this is someone who is with you on a full-time basis, you definitely are going to need to teach them how to be you in the kitchen, particularly if they're in your home and watching the children every day. In terms of like sleepovers, or if my mom and dad, for instance, have the kids over, I feel comfortable for them to be able to maybe to prepare them food while they're there in a dedicated pan with food that we bring, and And that has, become an evolution of events where that is something now that the kids really enjoy, that opportunity to do that. For us, for regular babysitters who come in at intervals, I do not have those people cook food for my kids, just because it is a hard thing to do, to learn how to read labels and to be able to cook without cross-contamination. We do not have food in the kitchen that anyone is allergic to in our house, so cross-contamination in our particular home may be less of an issue. I know that some people do have the foods that their children are allergic to in their house and cook with them. And in that circumstance, I would be a little bit more concerned about people, cutting one person the cheese and then cutting the brother an apple who's allergic to cheese and forgetting, that they clean that. That is something that is second nature to us, but is very, very normal, and that's normally how people prepare, food and snacks for kids, which now seems crazy to me, but that is how we used to do things. So I think this, this question really depends on who is babysitting them and how committed are they, and how involved are they in your day-to-day basis, in your day-to-day life.
And how open they are to being educated, learning, and potentially taking baby steps. Each time they could take on a slightly greater responsibility, and that's also the key to a lot of this is that one of these secondary care providers doesn't necessarily need to jump into making a meal from scratch. That there can be steps that they can do along the way, from serving the pre-prepared item that you had to preparing pasta and sauce, and just advancing that way as they get more comfortable.
Definitely, I think that's a great plan, because you don't want the babysitters to feel like you don't trust them. Obviously you do, because you're leaving your children with them, but you also don't want them to fail. So it is really a partnership, and the more willing that you see that they are to engage in the lifestyle that you need them to engage in, and they're excited and interested in that, then you found yourself a great babysitter, and two, it's exciting to teach people that process when they are interested in doing it, and then your trust will develop as their abilities develop, and so it can actually be quite a nice and rewarding relationship for both people. So it looks like our next slide is Playdates, which will be sort of interesting because Dr. Mike's children are a little bit older than mine, so it'll be good to see both sides of the coin here. So I'll just read the question, Dr. Mike, and then if we can just jump in on it. Looks like there might be two on this one. How do you avoid freaking the other parent out but ensure that they take this seriously? How will I know the parent who is hosting the Playdate will really understand when to use epinephrine? So, there's a very fine line about freaking the parent out. So I have this story where one parent said to me, I want to invite your children to my house, but I am afraid I will KILL them. And at first, I was very upset, and I got in the car and I thought, well, how could she say that? That's such a mean thing to say. And then as the day went on, I realized that what she really meant to say was that she was afraid, and she could have left out the kill part, but I understood what she meant at the end of the day, is that she wanted to, but she wasn't sure the steps that she should take or that she needed to take to feel confident in having our children there. And I think that the more you can know the person who is hosting the Playdate, the more you know them, the easier this becomes. So you don't want them freaked out, but you want them attentive. And so there is that fine line where you don't want to scare them so much they don't want your kids over, but you want them, attentive enough that they're going to be able to handle an emergency.
And that is one of the very challenging things. And again, the challenging thing now that we're in our Playdate section here is that we're potentially dealing with all these different families, with all these different ways that they express themselves and ways that they deal with stress. And now they're taking on a potentially stressful situation where they are going to be in the situation where they're going to count on us on giving them information, on teaching them something new, and trusting them. And so this is where communication is going to be so important. And the elephant in the room that Dr. Sarah was just talking about, where it's going to come up, the chance that there could be an accidental exposure that can lead to a life-threatening allergic reaction. That is a scary thing to people, especially when there's people who don't exactly know the basics of food allergy management and who do perceive it as a more dangerous thing than it is. And if you have a lot of uncertainty, that ultimately can lead to assumptions that are scarier than reality, and they may feel like, wow, I really might do something that's going to hurt this kiddo. And so if we are really able to calmly, adequately, and in a organized fashion educate them and let them feel confident that they will do a good job, then they may be able to be able to pull it off. Now, what is pull it off? I guess how much responsibility are we going to give the parents of our kids' friends? That is going to depend on our circumstance, our situation, and the age of our child. My kiddo's 10 now, and so the majority of his playdates are drop-off, and sometimes they land around mealtime, sometimes they don't, at least for now, we have been supplying the food that he eats when he is not at our home. We don't have people prepare from scratch, and for now, this is what feels pretty good to us and to the families that take care of him.
Yeah, I agree. I mean, I think that you really do have to just, you know, my kids are younger, so they're in first and second grade. And obviously my 3-year-old, we don't, you know, do drop-off play dates with her. But, you know, I've always gone on all the play dates with them, and I think that's been pretty typical of this age group. And I do notice as they get a little bit older that they want a little more independence, and they want to be, you know, dropped off. And so that's something that we're working through right now. We actually, one of their friends wanted to have a play date with them, and it was interesting because she had asked me in the classroom during a party. You know, we wanted to have the kids over, but we weren't really sure if we could make the house, you know, safe for them. We don't know how, you know, what I should do. And then it was funny, about 2 other moms said, "Oh, we wanted to ask you over too, but we just were afraid to." And so, you know, I think that that is also part of this evolution of having your kids be able to go on play dates either with or without you, is to let people know that you are accessible, because that is part of growing up. It's part of learning about other people's homes and seeing where your friends live. That's really exciting. And so whether it's with you or without you, it is sort of nice to open up that conversation with other parents to let them know that, you know, if there's a few things that they could do, that you'd be, you know, definitely interested in having the kids play together outside of the school setting.
And again, the baby steps thing is really helpful in that starting off with you being present and then ultimately transitioning is something that could make it smooth and feel seamless. Another thing is, if our children are diagnosed when they're on the younger side, before drop-off playdates are actually happening, then in many cases, these are the same families that ultimately will be the same families who our kids are having play dates with the next grade up and the following grade. So it's a somewhat smooth progression. If our children get diagnosed first time, age 11, now that's going to be a slightly tricky circumstance, and it wouldn't be all that outlandish if during a potential play date there was some way that that especially with the newly diagnosed, that the families figured out a way to, if not be there, be somewhere close. So working through easing into it really does make sense, and you don't have to just jump right into the pool.
Right. I think that's a great suggestion, you know, where if someone lives close to a Target or a Starbucks, you could drop them off. One thing about the drop-off things that I just want to mention again is dropping them off with that emergency health care plan, emergency action plan, is just, it's so powerful for the other parents to feel in control. And I think if you can do that, and you should do that, that will really help people feel safe and also give your child a little bit of freedom. So say you drop them off there and you're like, well, I'll be at the Starbucks down the street. So they get that feeling of independence, but yet the parents have been educated and you're, a block away. I think that's a great suggestion as a way to progress to more and more independence for the kids.
And I saw a question on the last one that I don't think we addressed, which is how do you know if the other person is up for the task of recognizing anaphylaxis and treating? And that'll be, using your trainer, going through that action plan with them. And now let's say they aren't. Then that drop-off isn't going to happen, but it doesn't mean the play date doesn't have to happen. It could be on your turf, at your place. You could just be honest and say, listen, this is a situation where I really feel like I'd like this on our turf because of the allergy. Please come over, and you could come and your child will come, and really it's nothing personal. Another potential is that if the kids are so old that a drop-off party is really something, or my fault, play date is something that they really need, or it just feels socially awkward, then possibly moving the venue and still sticking around, but in a place where it's more socially acceptable, like taking the kids out to a movie, taking the kids out to a sporting event, or the local mini golf place, then these will be ways to try to keep the social interaction between the children, and then potentially, again, ease yourself into it to the point where everybody's comfortable with a drop-off.
Yeah, that's great. While we move on to the next question, and this is definitely a tough one. What is the risk of reaction due to contaminated toys and surfaces? Should I worry if other children have eaten my child's allergens and mouth on the toys? I can just speak from first of all, just from my experience. When the kids were really young, and one of my sons allergic to milk, egg, wheat, oat, barley, it goes on. And when they were really little, and really the play dates when the children are little are really for the moms or dads to socialize and the kids to sort of play with little toys. They're not really engaging with each other that much when they're really little. So what I would do in that toddler age and younger, which I know we have some listeners who have children that age, is if my friend wanted me to come over with the babies, what typically I would do is bring our own blanket and bring our own toys. At the age where all their entertainment comes from mouthing their toys, there is some risk inherent in that. If one baby just finished eating, their cheese puffs or the baby formula, and then my child takes that toy, there's obviously some risk inherent in having allergen on the surface and then having allergen on that surface go into another child's mouth who's allergic to it. And most of, all of my friends understood that, and it wasn't a really big deal. And then, of course, when they come to your house, that was always a little bit tricky for me, and I don't know if you can think back about this, Dr. Mike, but when the kids would come to my house, it actually was a little bit more nerve-wracking for me, which doesn't really make sense, but it's because they didn't often bring their own toys. So then they were eating on the toys that were my children's. So what I usually would do is give them a group of toys for the other friends, and then we would hand wash them with soap and water, or stick them in the dishwasher after the friends had left, because it's sort of hard to invite someone over and then they don't bring their own toys and then you don't let them play with yours. So that was a little bit tricky when they were young.
Well, it sounds like you came up with a pretty good approach to it.
It really did work for us. Now, as they got older, one thing that my husband and I always say is we watch and wipe. So even one of my first grade sons, the one with the more food allergies, he of course is a nail biter, which is just another, of course, sort of situation. And he's still at the age of, and I think we've discussed this before, Dr. Mike, is in that first or second grade age, you think that your kids have finally stopped putting their hands in their mouth, but really they haven't, because now they're talking about all their loose teeth. And you want to, they're always fumbling with their loose teeth and their teeth coming in. So, one thing that we, notice, even when they play baseball, they play on their baseball teams and they're handling bats that other people have handled, is, we just keep an eye out. And if, reminding them not to put their hands in their mouth, or occasionally we'll walk over with a wipe and wipe their hands down just so, they remember that they need to, be cautious about getting allergens off surfaces and into their mouths. And that is just a constant reminder. Go ahead.
There's a couple cool little studies that one study was looking at. This group was very interested in knowing potential exposures of children to pesticides. So they wound up looking at children of different age groups and how frequently they mouth objects or their hands. And what they found was between the ages of 12 and 24 months, they put their hands in or an object in their mouth close to 80 times in an hour, and between the ages of about 24 months and 5 years, about 40 times in an hour. A similar study looking at adult transmission of viral illness was looking at people in a library and looking at how many times they put their hands in their eyes, pick their nose, or in their mouth, and they found adults were pulling about 15 times an hour. And so there, your first grader touching his teeth and touching his mouth is completely a normal a normal thing that any person, even adult, would do.
Mm-hmm.
And then it's good to know that standard cleaning strategies work. So soap and water, whether it's pump soap or bar soap, and hand wipes work to clean allergens off of hands. Purell does not. And then to clean a tabletop, commercial cleaners, commercial wipes, and soap and water work.
I mean, there's definitely ways to keep your kids safe from those sort of surface contamination issues, and still let them, play ball and play with their friends and go to Disney and all that. All right, so it looks like our next topic is parties. This is always a tough one. How do you handle invitations from children whose parents you don't know very well? So we've definitely had this experience in particularly the twins classroom, the kids with the food allergies. And we have not yet dropped the kids off for a birthday party. They're in first grade, and I just think that birthday parties are such a hectic time for the parents, for the kids. It's just always such a busy time that we tend to go with them. And I would say probably at this age, maybe 30% of the parents still will stay. So we're not, an anomaly. But I do recognize that there's going to be a transition coming fairly soon where, the parents don't stay at the parties very often. So we typically will go to parties even if I don't know the parents very well. I usually do make a phone call because I like to know the timing of when the food is going to be brought out. There have been a couple of times where we've had to politely decline an invitation just because they were going to be serving cookies throughout the party, is sort of just like you could graze and eat throughout the whole party, and that just didn't seem like that was going to work out very well for us. There was also one where they actually made food, and it was very sweet because the mom asked what foods, that we should stay away from, and when I gave her the list and there was a silence, I actually sort of laughed and told her I was kidding. And they, they didn't attend that party. But I usually am going right now. So are you now dropping off, Dr. Mike, or what is your situation for birthday parties? They're tough.
Yeah, well, we drop off. Scott brings his own snack, but now we're sitting here in the 4th grade, and many of the parents have already been educated and already very aware. He's not the only kiddo with food allergies in the grades, and yes, so there's three classes worth of children, and so they're all kind of cycling through with each other. And I think that many of the families have now been educated. Starting in kindergarten, you know, that's when folks come on in and they're absolutely brand spanking new to it. And then you got first grade, second grade, third grade, fourth grade, all the way up. The parents start learning more and more and more because they start hosting these drop-offs and these play dates and getting trained again and again and again. Now, that's still, I'm not going to trust many of the food items that have been brought in by someone else without a label. I'm not going to have any baked items that my son will have, or even items brought in from a bakery that people state is free from allergen, because not everyone knows how to ask questions like we all know how to ask questions. Not everybody knows the concept of cross-contact, and so there can be some items that aren't necessarily allergen safe that come in contact at the party itself when they're plating the food. And so what we've been doing is having him bring his own, and he's a trooper. He's done this for years. This is his thing. He knows that he comes with his own snacks. He doesn't expect to have anything else, and he really, luckily, he's been really enjoying himself, and it works nice. And that auto-injector is always coming with him, and if we drop them off, then the hosting parent or adult has expressed a knowledge and an understanding and a comfort. They would be able to treat him if there was an allergic reaction, that they'd be able to recognize the allergic reaction, and they know that the allergy action plan's in there with the trainers, and we've reviewed it. And but what's nice is a lot of these parents, they've done it before.
Yeah, that definitely does help. One little trick that I have figured out that works for us, that may work for other people, is, you know, typically they do the playing before, and then, you know, then they transition into like the pizza and the cake. So what I usually ask for is if they could leave me an end of a table that's clear of all food. And what I usually do then is set the kids up at the end of the table, so they're still part of the party, but yet they're not having kids eating the allergenic foods on either side of them. And I usually just wipe that down with the chairs down separately. As the kids are playing, I'll sneak in and do that, get that all kind of cleaned up. And then the kids will sit in those seats. So they're still part of the party. They're eating their own food in a spot that's been cleaned for them. And that just seems to help a little bit with, you know, if they're having someone passing out the pizza, then they're not putting it down on their plate. They're just in, you know, a little bit of a separate area, but not separate. Just kind of at the end of a table, which has kind of worked for us. So they're still part of the party and can stay during the food with their own food, but be in a safer spot. And particularly that was when they were even younger. And, you know, now I'm noticing that they want to sort of sit wherever they want. And, you know, that will transition as they, you know, better understand, and their friends continue to learn with them how to keep each other safe. I've also noticed, as you were saying, as the parents get to know you in your school system, if you have the, you know, blessing to be in the same group of friends, I've noticed a huge transition in the goodie bags. They're really becoming more and more food-free as we have paved the way for you know, food-free goodie bags. So that's sort of been nice too.
It's just to throw that in there. That has come up for us, and when we get the food goodie bags, we do a trade-in and we get them a treat, like more like a toy for trading in the goodie bag. Yeah,
and then, you know, that's another good point. As you are leaving parties, sometimes the parents just hand the goodie bags, and then you get them in the car, and you're hectic, and they're all in the car. But you just never want to forget to check the goodie bags, because if they have a goodie bag handed to them by an adult, they may assume that that's a safe food for them, especially the younger kids. So you never want to forget that someone may have handed them a goodie bag on the way out. Make sure you check that before you get in the car.
You know, and this also just makes me want to kind of bring this up now. This is kind of a general point about this entire webinar, which is we're really talking about things that we really crave socially, and our kids' participation at these parties really is a really nice thing. And so trying to make it so they can participate not necessarily exactly as every other child is, but as a way that they, our own children with food allergies, can participate while being able to not necessarily bend other people out of shape. That's really key and really important. And so, you know, in the case, let's say there was a kid, my kid's age, where the drop-off party really is the norm. If there was a circumstance or situation where that really was impossible, then trying to participate as parents and maybe offer to help out, help serve food, even be at the place where the party is, but maybe stay outside, or potentially, you know, if it happens to be at one of these arcades or something like that, be there with your other children to be able to intervene if necessary, if there was a reaction and everybody knows where you are, and then also to be able to kind of set them up like Dr. Sarah was talking about, and to potentially ensure that there is a place free of cross-contact, if that's necessary at this point, because there's still ways to make these things work, even if the blatant drop-off is impossible.
Yeah, I mean, I think that the one thing that food allergy has inspired me to do is become more creative. And that's part of it, is how can you keep them involved? What do you need to do? And it's often, you know, I don't want to call it a burden, but, you know, the burden of creativity really falls on us. How can we make this work so that they can be with their friends and be part of this while still being safe, and where I am present at a point, you know, at a place where I can, you know, be there if I need to. So you know, I guess that's just part of our new role, you know, as food allergy parents, is really, you know, hiking up that creativity and figuring out how you can keep your kids playing with everybody else in a safe way.
All right, and then we got this question here: the dreaded parties at pizza and arcade venues. Dairy is everywhere at these places, pizza, ice cream, etc., and no one is washing their hands after they eat and before they play. How should I deal with this when my daughter has a severe dairy allergy? So this is a real challenge, and this takes many of the questions that Dr. Sarah and I just dealt with and kind of throws them all in one. We got the cross-contact question. We have the hands in the mouth question, because as the children play, especially when they're younger, inadvertently they're going to be putting their hands in their mouth, nose, and eyes. And if other children who just ate ice cream are crawling all over the balls in the pit, and then and grabbing hold of things that other kids were drooling their saliva all over and putting things in their mouth, and then our child takes their hands, puts them in their mouth, then potentially they have cross contact. So that can be challenging. The older the kid, the easier it's going to be, especially if they have good self-management strategies. So the older kids, like a kid in the 4th grade or 5th grade, if they are used to washing their hands before they get them anywhere near their face, then this should make a very big difference for them. If you have a little one who's constantly exploring with their hands in their mouth, then this is going to be a pretty stressful situation.
Yeah, definitely. I think so much of it has to do with them knowing and remembering to wash their hands and keep their hands out of their mouth. You know, I'm sorry, I actually just got a message from my school, and I just want to make sure everything's okay. Mike, can you just take over for a second? Sorry,
yeah.
Thanks.
And so this is where just knowing the developmental age of your child, knowing what they're capable of, and then assessing the situation. And again, this may be a circumstance where you need to say, you know what, thank you so much for the invitation. Let's do a play date another time, but for now, we're going to have to pass because I can't really see how we can get around the potential for a cross-contact exposure here. But for the most part, we can usually figure out ways to make this party something that the child can attend.
Well, thanks, Dr. Mike. You know, we're getting close to 3 o'clock, so I'd like to just ask a few quick questions and maybe you can answer them. Do you have a babysitter training module on your website?
We have a prevention training module, which also includes how to read a label and how to give an auto-injector. And then we have, well, that's a prevention, and then we have a preparedness. So those are on the website.
Okay, great. Okay, I wanted to make sure I asked that question. And a few
You know, what we also have is, and it's very applicable to this, with the playdates and the parties, and this was part of the reason we created it, was a module to increase awareness for the parents of kids within our school without food allergy. So this way, it's 6.5 minutes, just the introduction, which gets parents to understand why it is that our kids need to do certain management strategies. And then they have the option to learn more. They have the option to learn how to read the label, how to prevent cross-contact, how to give an auto-injector, how to recognize anaphylaxis. So if they are going to take on a play date at their home or at their party, they'll be able to have the skills that they need to implement food allergy management. And so hopefully these parents will really want to learn more. And so this way, what we hoped for is that a parent could send a link to these good-willing parents. They can check it out before the party when they have plenty of time to learn, do it on their own time, and then they're ready to go.
Yeah, and that is a great, I'm back, sorry about that. We had a couple hives on a cheek. But I think that that module is particularly good, and I feel like, you know, the more education that you can give to the parents and the kids, the better. I have kids coming up to me at lunch saying, can I wash my hands? I had a donut and I know there's egg in there, and I know Mitch is allergic to egg. It's just, you know, you get everyone on board, and through things like, you know, Dr. Mike has on his website, and people really start to understand it, and it really just creates a great community.
Okay, well, thank you. I'm just going to go ahead and wrap up now since we're getting close to 3 o'clock. Thank you to both of you for being here on the panel today and answering questions from the audience, from parents. Caregiver situations bring up so many transition issues that make us worried as parents, and just hearing another couple of parents who also are really well qualified and accomplished allergists make us feel very normal to know that we have similar worries that you share as well. If you'd like to also follow up, don't forget to join our online community if you're not already a member. We share experiences as parents on our community all the time, and you're welcome to join and participate in those conversations. So as I wrap up here, we have 3 winners that we're going to give away gifts as we usually do every webinar. The first winner of Dr. Mike's children's book, Everyday Cool with Food Allergies, is Jennifer Bates, and Kim Giles and Lisa Rutter will both receive a KFA beach towel in the mail. So we'll be in touch with you to verify your contact information so we can get those to you. Thank you for joining us. What I'd like to do next is to thank you again for submitting your questions, and I know that we couldn't possibly get to all of them, and you asked so many good questions. I noticed a number of caregiver questions regarding daycare and preschool. That's a whole other topic of conversation that would be a great opportunity for us to have for a future webinar topic all into itself. I want to just also tell you that theallergistmom.com and Dr. Mike's website, allergyhome.org, are great resources, as are kidswithfoodallergies.org. All Dr. Mike, Dr. Sarah, and KFA all have Facebook pages as well, so try to connect with all of us there if you're not already. So to follow up, as the last comment, just make sure that you look for an email to follow up. We'll give you a link to the archive session. And if you also get some follow-up from us regarding specific questions. Some of you asked regarding hand sanitizers and other things that we can just follow up as additional information to supplement this session today. Our next webinar will be on June 19th. We're going to try one at 5 p.m. Eastern Time, and Colette Martin, author and baker, is going to be helping us learn how to make a perfect birthday cake without wheat, eggs, milk, and nuts. Colette did a really nice webinar for us last November about using substitutes, and this time she's actually going to step us through how to make a really nice cake. So I hope you can join us then. We'll have a survey for you to take at the end of the webinar when we close out, and if you have any follow-up questions that you want to just ask us about today's webinar, just reply back to the email that you get, and we'll try to answer them for you. Thank you again for joining us. Bye.